Epilepsy is a disorder of the nervous system that causes a person to become unconscious suddenly, often with violent movements of the body. It is often caused by a sudden change in electrical activity in the brain. Some facts about epilepsy are: epilepsy means seizure in ancient Greek. The sign of epilepsy ranges from just a slight smacking of the lips to staring into space to generalized convulsion. An interesting fact that I just heard about is that the symptoms were described by a Greek physician named Hippocrates. His work is amazing. He describes many other diseases unknown before his work, like heart disease and lung cancer. Many public places were named after him for his incredible work in medicine history. All kinds of people may be affected, different age, sex, and race. Epilepsy is not a rare disease. More than 50 million people are affected with it. In the US, 3.4 million people are affected. This disease is as common as adults over the age of 60 as children under the age of 10. Most cases are usually diagnosed before the age of 5. If one of your parents suffers from epilepsy, then you have a greater chance to be born with it. On the other hand, babies can be born with it without any family history of epilepsy, but parents may have some abnormal brain waves. 6 out of 10 people with epilepsy do not know the cause. Epilepsy may be caused by trauma, like insufficient oxygen to the brain at birth, head injury, heavy bleeding, infection before, during, or after giving birth, or alcoholism. Those causes are just as simple. Many others exist. People with epilepsy are diagnosed by being tested with a number of different tests. But first, they usually suffer from a seizure, which leads them to the hospital where the final diagnosis occurs. Different types of seizure can occur. The first category is called general seizures. Those start in all different parts of the brain and do not cause a person to lose consciousness. Under that category, 6 different seizures appear. The first one is an absence seizure, commonly known as a petit mal seizure. This one occurs without any warnings and is gone in less than 15 seconds. The person will most likely have a blank expression on their face and stop talking for a short amount of time, and then goes back to being completely normal and alert. This type of seizure may be mistaken with daydreaming because it is so quick and no major physical symptoms can be seen. The second one is called a myoclonic seizure, which increases a person's muscle tone. The reaction is really quick, and people affected by it describe it like a jolt of electricity through their muscles. The third one is called a clonic seizure. This causes a person to experience muscle spasm and jerk. The most common places which it occurs are in the elbows, head, and legs. The fourth type of seizure is a tonic seizure. This particular seizure causes a person's muscle to stiffen and to lose consciousness. As their muscle contract, their eyes will roll back into their head and they will arch their back. It will also cause the person to have difficulty breathing, and their face will start to become blue from the lack of oxygen, and they will also make gargling noises. The fifth seizure under that category is the most graphic one out of all of them. It is called a tonic-clonic seizure, also known as a grand mal seizure. The person will start experiencing symptoms of a tonic seizure and then move on to symptoms of a clonic seizure. When a person wakes up, they will be very tired from all the energy they let out from the seizure. Their muscle will be sore from all the involuntary movements and will be very confused and in need of an explanation of what just happened. The last type of seizure under that category is called an atonic seizure, which causes a person's muscle to completely weaken and the person will most likely crumble to the ground. The second category is called a partial seizure, which begins in one part of the brain. 2 different intensity of the seizure falls under that. The first one is simple, which only occur in one area of the brain and people do not lose consciousness. The second one is complex, which also originates in one part of the brain, but people will lose consciousness for this one. Once they arrive at the hospital, the first test that physicians perform is called an EEG. It uses electrodes placed on the head of the patient to record brain electrical activity and find the exact place in the brain where the abnormality is. Some physicians might want to have the patient completely motionless or go on with their normal day-to-day activities. Also, in some cases, a patient can be hospitalized for up to 2 weeks and videotaped to see what they were doing while the seizure occurred and how their behavior changed. Some other techniques are MRI and fMRI. An MRI shows a detailed picture of the brain, and an fMRI measures electrical intensity shift and blood flow and indicates what region of the brain is affected while doing a particular activity. A CT scan can also be used to look at soft tissue from different angles and figure out where the damage is. Now, different kinds of treatments have been discovered over the years. There is no cure for epilepsy, but different kinds of treatment can be used to control seizures. The most common type of treatment is allopathic treatments. Many sorts of medication can be administered to control and decrease the amount of seizures. Some patients may have to combine two drugs, but usually one medicine is enough. Here are just a few examples: Dialton, Tegretol, Depakote, and Klonopin. The second type of treatment is relaxation. Relaxation helps the patients feel calmer and decreases their stress level to prevent abnormal brain waves. Yoga and meditation can also help. Acupuncture can also help feel relaxed for 30 minutes, or acupressure if the patient fears needles. For some patients, especially children who suffer from photosensitive epilepsy, part of the treatment consists in avoiding television screens, computers, or video games. The seizures may occur because of rolling images, rapid flashes, or patterns of different shapes or colors. In order to relax the patient, aromatherapy is used to create the condition of a more peaceful behavior. Aromatic plants can be mixed with water or oils to spread on the body or used during a massage. Also, aromatic plants can be used as fragrant to change the atmospheric smell. Researchers noticed that ylang-ylang, chamomile, or lavender are beneficial. On the contrary, rosemary, hyssop, citrus, sage, or sweet fennel tend to stimulate the brain. The third type of treatment is nutritional therapy treatments. The ketogenic diet is used for patients for whom other treatments failed. It is a high-fat, low-protein, low-carbohydrate diet which induces a mild starvation and dehydration. This diet is adapted to each patient regarding his or her age, height, and weight. The purpose is to produce a lot of ketones, which are natural chemicals with seizure-suppressing properties. This procedure is used to reduce seizures while reducing medication. This diet works best on children between 1 and 10 years old. The final option for treatment is surgery. It's the least common treatment, but physicians offer it to patients where other treatments have not been successful. Also, the part of the damaged part of the brain must be accessible by surgery and won't cause a lot of personality change, decrease people's senses, and decrease the patient growth and fine motor skills to be able to function day to day. Some surgeries include lesionectomy, which removes the lesion-diseased brain tissue and surrounding brain tissue. The temporal resection, which removes part of the temporal lobe and part of the hippocampus, which controls memory, feelings, and emotions. And the last one is extratemporal resection, which removes some of or all of the frontal lobe, which regulates judgment, planning, movement, and personality. When a person is suffering from a seizure, he or she must be laid down immediately to prevent any self-inflicted injury and to make them comfortable. Make sure to tell people walking by to keep moving and to stop watching. No one should hold them down in case of involuntary movement from the person having the seizure that could hurt them or you. The people helping should also protect the head of the patient with a towel or jacket to avoid head injuries. If the person has his or her mouth open, it is safer to turn them on their side and to not put anything in their mouth. It is impossible for a person to swallow their tongue. The person's head should be turned to the side and on a downward incline to help his or her breathe and to avoid them choking on their saliva. Finally, you should time the length of the shaking phase of the seizure. You should call 911 when you are not sure if the person has had a seizure before, if the seizure lasts more than 5 minutes, or if the person is injured or vomiting. This type of disease affects the entire family, especially the siblings. Other kids may feel a decrease in attention compared to the sixth sibling. Communication about concerns and problems on a regular basis can prevent problems between members of the family. Parents can also feel depressed and sad because their child is suffering or hurting. Families should seek for help. A couple of associations offer help and support to families who face epilepsy. Some of the most famous are Epilepsy Foundation, Metropolitan New York, American Epilepsy Society, and the Epilepsy Foundation.